Welcome back. I'm pleased to still be joined by Kirsten Watkins, Director of Workforce 360 and Development Programs, and Bethany Studenic, Assistant Director of Foundation Relations at Ohio Guidestone. They've been giving us lots of important information. We're so glad you ladies are here. Please, let's continue. Let's talk about some of the other things that you do. Workforce, wonderful. I'm glad to hear it, the programs you're into. Let's talk some about, you were almost founded on, as you said, as an orphanage. So let's talk some about foster care. Let's go back and talk about that need and how we can be addressed.
Absolutely. So foster care is kind of the heart and soul of what we do, along with our residential treatment center. And this is kind of what our roots are. We started by helping children who were having a struggle with finding a family, being a part of a family. So our foster care services, we're looking to pair children who are, out of the home with people who will give them a loving, supportive home. Now, we have amazing foster parents right now, but it's always a struggle for us because there are more kids than there are foster situations. So our foster families work really hard, and they're wonderful, wonderful people with a lot of patience because they bring children in who don't have anywhere else to go, and they treat them like one of their family.
Now, who could be a foster parent, and how do you qualify them?
A foster parent goes through a vetting process, so if you are interested in applying to be a foster parent, please give us a call. Our main number is 216-234-2006, and we'll get you connected with our foster care department. We are always seeking foster parents. Of course, we are careful with who we have be foster parents. We need to know that you have the skills to take care of the children that we're going to be placing in your care. It's a huge responsibility.
You're shaping lives.
Absolutely. These children's futures are in your hands. So we're constantly seeking people. There are supports through the state of Ohio to support you in your endeavor to become a foster parent. But if you feel like you're a giving person who wants to give back and take care of students and children who really need you, and you want to have that influence in someone's life, please give us a call. We can make that happen. We can talk you through it. If you have questions, we can answer them. So please feel free to reach out to us.
Give that number again, please.
It is 440-234-2006.
All right, we'll give it again before we're through here. Let's talk about one of the other things that you do, and the many things that you do, and that is residential treatment programs. We hear about the opioid epidemic, over 90 people a day dying from opioid overdoses, and literally more than died in the Vietnam War per year dying because of this. That's a lot of folk. And this drug, scourge, is not getting any better, unfortunately. Talk to us about the treatment that you provide and how one could qualify, or how you get them into the program and how you help save their lives. Not just about opioid, but just about the other addictions they might have as well.
Absolutely. So that's something we see as a growing problem, just like everybody else is seeing. The opioid epidemic is really truly an epidemic, and what's interesting about it is that it's not something that's centered just in urban centers or in other areas where we traditionally see those types of issues. This is something that is affecting everyone equally. Your average user of a substance like this is a young white male, a lot of times living in a rural area. So it's a different type of issue that we're seeing. I know there's been a lot of initiatives around naloxone treatment. Cleveland has been doing wonderful work with that, but we need to go even further. So for us, what's interesting about our services is that we do community-based mental health counseling. So instead of having our clients come to a central location and get help, we go out to them. We go in their community, we talk to them, we work with them, we see them in their environment, and we make it a lot easier to get to services. A lot of our clients have a difficult time getting transportation, getting to and from appointments. They have children they need to think about. So finding childcare can be a challenge. We get rid of all of those barriers by coming out and seeing you and coming and talking to you in your environment.
How do you help them get over the stigma that is associated with needing or wanting mental health services? Because many folk go, well, I'm not crazy. Well, maybe you're not crazy, but you may need some help. All of us get depressed, at one point or another, and we have various issues.
Right.
How do you help people who may need that help, but say, I'm not going to go because of the stigma attached to it, either societally or internally?
I would say it's a difficult question. We try to have conversations just like this one to talk to people about how important it is that you build a foundation that you can build on for your life. I think if you are questioning whether or not you have a problem that needs treatment, you probably could benefit from talking to someone. Even if you don't feel like it's severe enough, err on the safe side. This is your life. Call us, get an appointment, start talking. At the very least, it will help. There's no way that this will hurt to start talking about it. I understand that there's a stigma attached to it, but the longer that we give in to that stigma, the worse it's going to be. We need to come together as a community and say, we're going to be seeking help. We're going to reach out to people and say, if you need help, come to us. And that's where we are at Ohio Guidestone. We don't see you that way. We do not see you as a stigma. When you call us and you say that you're having a problem, that is what we do every day. That is why we exist. So call us, get an appointment, and start working on this, because it will only be beneficial.
We're not passing judgment, we're reaching out to help.
Absolutely.
Yeah.
Absolutely.
And ounce of provision worth more than a pound of cure also in this instance.
And I think it also is based on the relationships that we have with the population that we're serving, the people that we're serving. We have strong relationships with them, and so they feel safe. It's a safe environment. They feel as though they can reach out and ask for additional help. Whereas maybe when they walked in our door the first day, they didn't feel that way. But ongoing, as the relationship is built throughout any of our programs, it's not just workforce, but any of our programs, we can refer our clients within Ohio Guidestone to other services and programs. They can refer to us. We can refer to outside community resources as well. And so I really think that for a lot of these individuals to start progressing towards getting themselves a little bit more stabilized and feeling like they can function more, it really is built on that relationship.
Do you need or use volunteers?
Yes, we do.
Talk to us about that need.
So overall, as an organization, we utilize volunteers across the organization. Any and all of our programs can utilize support. We need help with events management, to volunteering, to doing mentoring, and I know, Kirsten, you use them pretty heavily in workforce, if you want to talk about that a little bit.
Yes, we do. We use them in workforce. We bring them in as tutors for GED or some of the occupational skills training. We use them for anything, really. Some of the skill building in our classes. We have interns that can come through as part of their bachelor's degree and or master's degree. We have clinical interns that come through. We have non-clinical interns that come through. So we can use them in whatever capacity.
So if you have the desire to give back and don't know exactly what it is you want to do, call Ohio Guidestone and see if you can fit into one of their programs. And if not, they can refer you to somebody else. But the bottom line is that we all can give something. And there's such a need in so many categories out there across the spectrum, because you know, we just need this help. There's so many reasons to want to help. So let's go back to the kids. I mean, every kid deserves a happy and healthy home. And it can be difficult. I know many kids who are in the foster care program, for example, they age out. How is that happening now? Have they upped the age? I think I heard something about upping the age for kids who would normally age out at what, 16 or 18 or whatever it was?
Yeah, they have just a bit, but that is something that's incredibly difficult for us, because we try to give kids as many opportunities and tools as we can while they're with us, so that once they age out, they have those extra supports. It's not something that has a lot of support through the governmental entities that sometimes support us. So it's something where we have to design our own programming. We have to find ways of funding it outside of those regular sources. And it can be difficult. It can be very difficult. What we try to focus on when we can is giving these kids the tools that they need to succeed while we have them in our care. So we focus on building life skills. We focus on making sure that they know that they have workforce there as an option, that you know, they can head towards college if they want to, or they can head towards something else if they want to, but let's make those plans while you're with us, so that whenever you do take those steps out, you have a plan of action. So sometimes that's the best way we can do it. We can always utilize support for that. We can utilize volunteers. We can utilize monetary donations. We work really hard to make sure our kids have what they need, but we're up against a lot with a lot of our kids.
Before you do that, let me just take a break, come back and finish, because we'll have a little bit of time on the other side here. Well, listen, if and when it happens, we talk about it right here on CLE 43 Focus. Here is just some of the topics we cover: family issues, the economy, education, and employment, as we're doing this morning. We also talk about health and health care, alcohol, crimes, drugs, domestic violence, and policing. Plus, we talk about housing and politics. We also talk about leadership, race relations, diversity, and inclusion. Now, if you know someone who could talk clearly about any of these issues, drop me an email at hboomer@cleveland19.com with their information so to be a guest on the show. We'll be right back. First, this message.